I got interested in physiotherapy a long time ago when I was playing competitive sports. I had a lot of injuries of my own and found that during the whole recovery process, I spent a lot more time with physios than I did with anybody else. So it got me really interested in the practice, and here I am. I spent time in a chronic pain clinic when I was on one of my clinical rotations as a student. Spent some time at Surrey Memorial Hospital working with people that had pain issues for extended periods of time, and the physio's role there was primarily making sure that every orthopedic issue had been looked at before they started working on things like medications and pain management. The big thing working in pain management taught me was not to think of pain as the body's way of telling you it's being injured, but to think of pain as the body telling you something, the body giving you an idea of what's happening, not necessarily saying I'm falling apart, I need help desperately. One of the advantages of shockwave therapy is that it can be used on those patients that have had pain for a long time. A lot of traditional treatment methods become ineffective if a condition has been around for too long. People commonly hear, well, you've had this for so long, I don't know if we can help you. But shockwave therapy is an option for those patients that have had long-term problems to potentially get some relief. I use the MasterPulse MP50 made by Storz Medical in Switzerland. And in a nutshell, it works by using very high intensity sound waves to do two primary things. One is to increase the amount of blood flow to an area, which allows the body to heal more effectively. And the second is it can be used to break abnormal tissue in an area such as scar tissue or calcium deposits that have formed. Scar tissue and calcium deposits restrict the motion of any tissue that they've built up in. So for example, if it's formed inside a tendon, you've now lost the elasticity in the tendon. It loses its ability to elongate and shorten with muscular contraction or with movement of the particular joint. From the treatments that I've used over the course of my practice, I found that shockwave therapy has a more complete effect when breaking things like scar tissue, and it tends to work a lot quicker than most of the traditional therapies.
I play table tennis in competition, and back about 5 months ago, I hurt my arm. I had started having pain in my arm during a match.
The injury that I had, I got playing soccer, and I partially tore my hip flexor quad complex. The pain level that I had was around a 7 out of 10. I could hardly put any weight on it. I tried personal training. I tried strengthening it up. I tried chiro. Nothing seemed to work.
I tried everything from laser therapy right the next day to massage therapy, acupuncture, even prolotherapy, and nothing worked. Until the time I heard about Paul doing shockwave therapy.
Immediately when I started shockwave therapy treatment, I felt my muscle loosen up, and automatically it started to feel better because the scar tissue was loosened.
What I found about shockwave therapy that really surprised me in a very positive way is that it seemed to be giving me almost instant results.
I feel great today. It took 3 treatments for me to feel this way.
So it's been 5 treatments and I am back playing 100%.
I am able to play soccer again to my full ability.
Well, first of all, what I like about Paul is it is very, very knowledgeable about sports injury, and because of the work he's done in palliative care with patients with an acute amount of pain, he can really relate to the pain, and also he's had himself serious sports injuries. So there is that connection where your physio actually relates to your pain, what you're going through.
The reason I came to see Paul was because I have chondromalacia in my knees, which is basically like a degenerative arthritis, and I needed some help in terms of managing the inflammation and the pain.
The second thing is as a human being and as a physio, he's very pleasant to be around. He's never stressed, laughs a lot, and we always have some good laughs during the treatment. It makes it really fun even to come here.
Paul is always the same. That is what I like about him. He's even-tempered, very customer service oriented, well beyond just the appointment time. He's flexible. He's flexible with time when you can be fit in, but mostly has such a positive energy that I feel that flows to myself, and that mind-body connection starts with him because he's so customer service oriented. So The better he is with that, the more I feel that's with me, that positiveness.
I would highly recommend Paul to any other table tennis player or any athlete who is suffering from a tennis elbow or even other injuries that shockwave therapy can help for. And Paul is amazing.
The main reason I enjoy being a physiotherapist is being able to help people that are having issues with pain or with mechanical issues, all of that stuff. And the reason I've integrated shockwave therapy into that practice is it allows me to help people in a more efficient manner. It allows me to get results a lot faster than I would with some other traditional therapies.